Oh, are you recording already?
No.
Not yet. Are you ready for me to get it started?
Um, yeah, why don't you do the recording?
Okay.
Since it says here.
Good afternoon, everybody. Welcome to our September Board of Health meeting. I'm going to go ahead and call this to order. I do not believe we have anybody for privilege of the floor, so we'll move beyond that right to approval of our the month that comes before September, August. Our August meeting minutes. So if we could have a motion from the floor to approve. We have a first from Sue, a second from Shauna. Any edits, comments, discussion? Changes? Okay. Favor is written. All opposed and abstentions. Vote. All in favor, one more time, all in favor? And that's unanimous. Great. All right, financial summary. Frank, I'll turn to you.
Yeah, Jeremy is planning to come, I promise, but he is out unfortunately today, so I don't really have anything to add to the report, but happy to answer any question.
I think I just had sort of a general question on just the percentage that we've spent so far,
Yep.
that it looks good. And I guess I just wanted to make sure that was an accurate assessment.
Yeah, I think we're in a good spot. Staff has been efforting the budget to see if we're ahead and where there might be some savings, because as you know, we no longer have the opportunity to use rollover, which was using past years and future years. So we're trying to be proactive about knowing where the budget stands and making any adjustments before the year ends. So we're feeling comfortable and we think there will be a little bit of savings. We're trying to figure out how much and where the most effective place to use it.
Any questions on budget? Okay, Dr. Claypack is not here and also not online, correct?
Correct.
Okay, any comments or questions on the medical director report? Board members?
Curious, because he keeps bringing up the overdose prevention centers. Is that going anywhere in the county?
Dr. Kleibeck is very interested in those and has been having a lot of community conversation and doing some public presentations about them. I don't think we're any further along on those than we have been.
Anything else? Okay, Frank?
Just one update, really continuing on the budget front. The legislature is in the midst of hearing from county departments. We went last week. All in all, I think it went well. Questions we answered. Legislature's got some difficult decisions that they'll be making, but I think from our budget perspective, the cuts that we had to administer were, as we said, for vacant positions that we weren't expecting to fill immediately anyway. So hopefully that maintenance of effort budget will continue. There are quite a few OTRs that we put out, some that are recurring multi-year that still have a couple of have a year on them. But all in all, you know, I think generally speaking, the department will be okay, assuming everything that's in the county administrator's budget is approved. And we're hopeful the legislature might be able to find funding for some of the others, but recognize it's very difficult here. So that's all I had.
Sorry, why is it a more difficult year than normal? What's happening? I can't remember.
Good question. No, there is, oh, there's Jeremy. There is, so the legislature's been going through some conversations over the last couple of years, particularly about their fund balance. And they've set some policy about where that needs to be. They've also set some monies aside for some big capital projects that are being proposed. And that coupled with learning about the previous year's fund balance in August of the next year. I think all of those things kind of got us to a place where there isn't extra fund balance this year.
There is an extra fund
There
balance?
isn't.
Oh, it's not, okay.
Yeah, and so they're trying to figure out how to continue to do some of the things they want to do. And obviously the tax rate implications associated with that too, right? There was an attempt to keep a budget that we had to submit that was at a 2% tax levy increase. The county administrator ultimately submitted hers, I think it was 4.45%. And so all of those things are what the legislature's contending with. I don't know, Shauna, if you have.
Yeah, I think the other part of that too is that our sales tax revenues are also down. And so from last year, we're down like anywhere from 3% to 8%. And so that's less money that we have to put into our budget. The other part of that is that over the past 3-4 years, we've had ARPA funds that have floated a lot of our operations as well as special programs in the county. And we don't have any of that.
Is that standard federal funding?
The ARPA was federal.
Okay.
Yeah.
And that's gone now.
Yeah.
So
So just remind me that as of now, there's a public health budget and a mental health budget. Is that true, or have they merged into a whole health?
There is a whole health budget, but the functional units, so the way that our budget is designed is that we have things called functional units, and typically a division like children with special care needs has a functional unit. Actually, you have a couple. They have EI and pre-K. CHS has a couple of functional units. Each of the clinic downtown is so those functional units all still remain the same because we have to budget those independently. They have been moved into a singular whole health budget. So if you were to look at the budget book on the county's website for this year, you would see whole health. We have 5 pages. We have a lot of functional units, more than most departments do. But it is all under a singular department.
Okay. Because the budget in here explicitly says public health.
Correct. So we provide to you all the public health portions as we always have.
Okay.
We're talking about what that might look like on the mental health side of things. So we actually keep internal budget tracking for the public health side because the reporting that we have to do, the county system can't give us the information that we need. So we keep it internal. And so the information that you see comes from our internal. We don't have that same internal one yet for mental health. The county is putting new systems in place. So we're hoping the new systems will meet the needs for both without us having to create something. If we don't, then we would eventually be putting the mental health stuff into our public health system, internal system as well, at which point we'd be able to kind of share that level of detail too. Thank you. Yep.
let's go ahead and move to Bristol, please, and the Division for Community Health.
Nothing to add to my report. I just wanted to introduce Sue Larada. I brought Sue with me today. She's a new senior community health nurse
Welcome.
in community health services. She'll be managing our IMSS program and lead poisoning prevention, and she comes to us from DSS. So.
And then you also started another new nurse, right?
I started 3 nurses,
Oh,
one in August and 2 in September. So I didn't bring all of them with me.
Okay.
But
Let's start. Okay.
we started to September 3rd.
Right. The 3rd. Any questions on any of this? Okay, Sam, health promotion. So I kind of wanted you to mention here what you had sent to us about the New York Public Health Association Conference.
Yes,
Okay.
yeah, so New York State Public Health Association is having their partnership conference in April, or it might be May 30th.
It's like April 30th to May 2nd or something like that, yeah.
Yeah. And it's going to be here in Ithaca, the new conference center. So excited to have this here and really hope for local representation in some of the presentations. There are presentations and posters that can be included in the conference, and we've attended before, and Frank's attended, I've attended, some of our team has attended. And it's a good conference. So I've been sharing that abstracts are due October 18th. So I've been sharing that with some of our community partners, and hope that internally we'll be submitting some proposals as well.
Yeah, and so just really wanted, because we're all coming from different areas of so their topics that they're looking for are addressing health inequities and social determinants of health, environmental health and climate and health adaptation, emergency preparedness and response, digital health and health innovation, health workforce resilience and burnout, and public health communication and misinformation. So if your organizations are doing anything on those topics, would just really encourage folks to submit, because how often do we get a public health conference that comes to Ithaca? It's so cool, it's so exciting. So those are due by October 18th. And then I guess I would also just encourage and hope that when registration opens for that if you're in a position in an organization that you can go, that we kind of show out in force. So that's my little plug for public health today. With that,
The work of the residents.
Yeah.
Intersects with that. I'm sure you're talking to Herb too.
Yeah, Herb and Judy, I can send it to.
Yeah.
But I'll forward to Corinne and she can send it to Judy, because
Perfect.
reach.
Yeah, sexy.
Yeah.
So I think, we have lots of partners who fall under. Stories about it. So.
we don't have to travel. You have to just go downtown. You do have to pay for parking, but
You can park at my house.
yeah,
it's
we can get
free.
my house
It's
inside.
my driveway.
We'll do shuttles.
Yes. Or Christina's, right?
Okay. All right, thank you, Sam. Is there anything else? Jessica. The special healthcare needs.
Yeah, I don't have anything to add. I just wanted to touch base on our speech language pathologist. She's almost up to her full caseload now. I know we reported that she picked up 15 kids. She's almost up to her full caseload. She's played a big role in decreasing the number of the children on our speech wait list. We were at 50. We're now down to about 27 on that wait list, which is huge. We haven't been that low in quite some time. And I've also had a lot of communication with some providers who are interested in starting in our early intervention program. So we're working on getting them contracted with New York State. Hopefully in the next couple of months, we'll have more providers and those wait lists will be much lower.
And why all of a sudden do you have people interested?
Yeah, one of the reasons is because of the stipend that we're now offering them from the OTR. That was passed, I think, in June, and we just sent out our contracts to our current providers who have, I'm assuming, spread the word to some other providers who aren't providing EI services, and they've reached out to me. So pretty flexible work. So even if they are working full-time in a different capacity, they can still be a early intervention provider and pick, as few or as many kiddos as they can fit into their schedule.
Could you email me whatever you sent to other people, please, about that?
Yeah, about that,
If you had a provider that was interested, like, what is it? What do they need to do? Okay.
absolutely.
Okay, anything else for children with special healthcare needs?
No.
Okay, environmental health is not here today. They're out of town. Oh, Adriel, sorry. You told me that. Good. Okay, go ahead, Adriel. Anything you want to add?
Your questions have been out of the loop on many of these items that are here in the report, but I don't have anything to add. Yeah, Liz, there's a environmental health DOH meeting training in the Syracuse area today, so that's where she's at. First report, nothing else to add.
Okay, and so the other thing I wanted to draw to the attention of the Board of Health is actually, in addition to the summary report from the division, at the back of the packet, after was the lead and copper regulation update for public water systems. I just wanted, before we go into anything else, I just wanted to see if anybody had any questions about that for Adriel while you're here.
And just by way of update, the lead and copper rule has a date coming up in October where all of the lead distribution.
Well, it is lead service line.
Service lines, thank
Service
you.
lines,
That's the
yeah.
lead service lines have to be reported. And then after that, there's a notification requirement for anyone that is connected to a lead service line. And then subsequent to that, there is a requirement to remove those lead service lines. So this program, this rule change it's a big lift. And I think that's much of what the memo is about, is explaining kind of what's coming. What we expect our role and responsibilities will be related to that, and just kind of wanted you all to be aware as this unfolds that while it's a good thing, it's a big lift, particularly for many of the systems that will be in the process of needing to replace these lines. And it will likely generate public interest as it unfolds.
Yeah, and I actually thought Skip did a really nice job on page 3 of his memo of summarizing for us the impacts on the Environmental Health Division, as well as the opportunities for public outreach and awareness for us to be aware of. And then for those of you who like history, there was a nice walk down history lane of all of the federal lead and copper regulations, which was kind of interesting actually to read and see the progress from a public health perspective of kind of where we've moved over the years on it. But I would just encourage folks to look at page 3, because I'm assuming this will continue to come up as it gets implemented and sort of the impact on the Environmental Health Division. So
Are there gonna be any funds to help support these regulation changes?
That's a really good question. You have to talk to your elected leaders about that. I think there is, not our local ones. There is some funding for the systems, as I understand it, but right now there is not funding for a property owner. So the systems could get money to replace the parts of the lines that are theirs. But as you know, for a homeowner or a business or anything like that, that usually stops at the meter out by the road, and all of those connection lines into your structure are your responsibility. So there's going to be challenge with that. The system may be able to say they are lead free, but your connection to your home may not if you're unable to replace it. But right now, I'm not aware of funds for that part of the project.
But are those internal residential commercial pipes part of identifying the lead structure, or they're just talking about the public?
Good question. Do you know the answer to that?
It's not internal of the building, but the service line that is the customer's portion is supposed to be identified.
And do you have any idea, are we talking 1%, 10%, 50%?
Percentage wise, I guess I couldn't tell you percentage wise, but I do know that, within the city of Ithaca, there's a number. I mean, there's probably hundreds.
Okay, so not a few.
So can I just make sure I understand what you just said? The service line that is the customer's responsibility would be part of what's identified? And then does that mean that the customer is responsible for that replacement, the cost of that replacement?
Right. Well, currently they're responsible, and as Frank said, as of now, we don't know of any monies that will be made available to help them.
I said that's all Fall Creek, but I don't think that.
Yeah.
Yeah,
So are people gonna start getting letters from the health department saying your house has been identified as having a service line that is lead based, and you have until August 30th, 2030 to have this replaced at your own cost, kind of thing?
I don't know the specifics, but they certainly will be notified once the inventory is complete, whether they're going to, with this notification, give them a deadline to replace. I'm not sure.
yeah. And so I think the notification is going to come from the water supplier, from us, I believe.
Okay.
And as far as, where, just for clarity, there is a part of the system that's owned and operated by the system gets to a meter, then there's a service connection to your home, that's your responsibility, and then there's the pipes within your home.
Right.
So those are three separate things, right? The inventory will stop at the service line that gets to your house. It doesn't know what pipes you have in your structure, right? So that's what the inventory will be about. The monies are available currently for the system part of, and not for the piece that connects with the system to your house.
Yeah.
Yep. Yeah, and please, and understand that some of our schools fall into
Yeah,
this
that's
as
what I
well.
was
We've
worried
been
about.
Yeah.
through this with them several years ago when we had lead exceedances in some of the water. They've been able to get those exceedances down, but I don't know that all the lead pipes have been removed from those systems. So that's just one example where, you know, there will be some cost and local impact that likely will come from that.
So then I guess my question for Shauna is this on the radar of the legislature? Do we know?
It's not on the radar. I know that the federal government has put aside billions of dollars to do some infrastructure work, and they know it's coming because I was in a conference meeting the other day, and they were talking about the trades and how they will need so many steam fitters and plumbers to actually do this work throughout the whole United States. And there aren't going to be enough workers.
Anything else on this? All right, so why don't we go ahead, let's go ahead to our enforcement actions. We only have one today. And so this is the Best Western, it's a pool concern. So if we could have a motion from the floor, okay, to approve it, and Sean is our first, Samara is our second. Adriel, anything to add aside from what's already in here for board members to be aware of?
I don't have anything to add.
Okay. Any questions from board members? Concerns? Okay, all in favor of approving as written? That's unanimous. That is it for that. So the last thing we have to do today is to do two things. First of all, to say thank you to Sue Markle and goodbye, all in one sad few minutes to say thank you for everything that you've done for the Board of Health, all the time that you have committed to being here as part of meetings, to the really great questions that you consistently bring to the table. And that we really hope that whatever is next on your plate, that is going to be fulfilling for you. And just really appreciate the community service and give back as being part of the board.
I joined when I started teaching public health microbiology at Cornell, and experience was just infinitely helpful this is what it looks like in at least one place, this is public health. And so I really feel like I got back more than I gave, but it's been a wonderful experience.
Thank you so much. And we have a certificate of appreciation for you. So for your office. You guys are good.
Thank you, Sue.
Yeah. Okay, and so with that, though, we need to establish a nominating committee.
Before we do that, so we also have, so Sue's position, but Dr. DeLima is also filling a vacated term. So her term is ending at the end of this year. She has voiced interest in returning to the board. So the nominating committee will need to consider both a vacancy and the re-recommendation of Dr. DeLima at the board.
Okay, and Dr. DeLima is sitting in what vacated line, just to remind everybody?
She's a physician.
I think Dr. Evelyn was.
Dr.
Yes.
Evelyn's there, yeah.
Yeah, so we are required to have 3 positions or 2? 2. Dr.
Dr.
Capel.
Capel.
Yeah.
Me
Oh,
and-
yeah, okay, right.
And yeah, 3.
Okay,
So we're
right.
required to have 3 positions, sorry.
Right, so just so everyone remembers, that's
Correct.
the
That's the
position,
position,
that's the
position.
position that she's.
This is an at-large.
Yeah, Susan's at large, okay.
Before we establish a committee, can we talk about what it means to be on a committee?
Sure, I can tell you from my perspective, it's ultimately your committee, so it can be whatever you want it to be. But what we've done in the past is we like to have, maybe 3 folks be a part of, reviewing applications, choosing who they'd like to interview. We use that word very loosely because they're volunteers. It's really just a Q&A, get to know the people that have applied as well as, let them know about the board from your perspective. And then that nominating committee makes a nomination to this board who they would recommend get put forward to the legislature. So it's really a meeting with the individuals that are interested, some deliberation on who you think would be the best candidate, and then bringing that candidate to the board.
Right, and how many, is there a rule of how many people have to be on the nominating committee?
No, there's
Okay.
no rule.
Okay, so, and do I have to do some sort of formal procedure for getting the nominating committee, or I'm just
No,
asking?
you as the president appoint those folks, so you're just looking for volunteers to
Okay.
apply.
So who's not here?
Yeah.
So I am gonna volunteer because I would like to be part of the nominating committee. So are there other volunteers who are interested?
I'll help out if you need.
Okay, Shauna,
I've done this before, so.
yeah, okay. And then maybe we can, I will just, who's not here? Just,
Ravinder
And
and
Ravinder.
Dr. Cabell.
yeah, I got him. And just those 2, right, that we're missing? Because I'll write to them and see if either of them are interested as well. Okay. So, right, so we've got 3 then to start, and I'll write to those 2, but
We have applicants, because we did do, I think we have 5 or 6 of them.
Oh.
Yeah, so we got some good feedback, so we will get those applications sent over to you. And Karan, if you could try to coordinate a time when those 3 people might be available, and then ask the candidates, we might need more than one time unless you want to sit here all day and talk to people, but we'll try to coordinate that for you and find some times in the next couple of weeks.
that's good.
So we're-
Yeah, because I think we've done it a couple, like sometimes we haven't had that many applicants, but other times we've been able to find a time where we just all come here for 2 hours and just meet with like people one right after another. Or we can also do Zoom at this point too, but
Oh,
I think
that's true.
I'd prefer to probably meet in person if we can, because it's a little bit of a different experience, so. So Karan, let me email Adam Ravinder and just make sure neither of them want to participate. But otherwise it'll be Shauna, Samara, and myself. Okay,
And what we can do is, in the meantime, send you the applications. We'll put a quick sheet, yes interview, no interview for each candidate that each of you can fill out, and then you'll know how many people you actually want to talk to. You might want to talk to all of them, you might not, depending on their applications.
okay, and so just so we're clear too, the applications that we're getting are for Sue's position. They are not for Dr. Delina's
Correct.
position.
If the
Okay.
nominating chooses not to send Dr. Delima's name
Okay.
forward, we would have to do another PR position, so. A physician that wants to come in in the middle of the day, so just
Well, I would also just give some feedback. I don't know what you did differently this time, but I saw that request for someone to be on the Board of Health in so many different, I got it from so many different directions that it was really, really out there. So
Yeah, you're good. That's the
Yeah.
most I've ever seen.
that's the most I've ever seen it. So thank you, whatever you did. I mean, I had people emailing me saying, I got this. Do you think I should have, should I put in for it? And I was like, how did you get that? So it was out there. So,
Listers to.
yeah, it,
like the diversity consortium this time. Yes, and then Melissa and I connected to think about some other people and broader reach, so we emailed some people directly too, I think. So that's great.
Okay, great. All right, anything else for the good of the group? All right, happy September. We'll see everybody in October. Meeting's adjourned.